Hey, what's up, everybody? Dr. Taylor, Aspire Chiropractic. I want to tell you about an interesting case, if you will, that walked in 2 days ago. Now, I say case, if you will, because I've been seeing this patient for, a couple months now. Basically, he's a soccer player, and we want him to perform as best as he can on the soccer field. He wants that same thing. So, cool. We meshed with those ideas. Young kid, but came in 2 days ago looking messed up. Color was gone in his face, kind of, disheveled. Obviously under a bit of distress. Mom brings him in here. Hey, what's going on? He's got an asthma flare up. Oh, okay. I know we talked about that when he first came in. When was the last time he had one? Well, he hasn't had one since he started to see you. Okay, cool. Let's figure out what we got going on. So, one, why would you go to a chiropractor for asthma? Because so much of asthma is affected by what's going on in your spine. So what is asthma in and of itself? If we've got these tubes here, this is your trachea going down into your bronchioles, going into your lungs, okay? So what we're going to do, we're going to look at a little cross section here of this specific tube, this airway, this windpipe, this section. We're going to take it, we're going to turn it on its side, and we're going to look at it like that. There's the outside of it. There's the inside of it. And then there's this mucous membrane on the inside here. What we're going to do, we're going to make that blue. And this is a regular patent means open airway. Goes in and out just fine. Now with asthmatics, for whatever reason, there's stuff that goes in here and irritates the lining of these bronchioles. And what happens when they get irritated, just like any other soft tissue that gets irritated, this thing gets swollen. And it makes the inside of that tube tighter, smaller, narrower. Easiest way to see what it's like for an asthmatic, and this is coming from an asthmatic, next time you go for a jog, next time you go to work out, next time you go and do yoga, take a straw, put it in your mouth, and breathe through that straw the whole time. That's what it's like for an asthmatic. When the inside of that tube swells up and gets inflamed and tightens up, there's less area for that air to flow through, which makes breathing harder. Now, we got these tubes that come down, they infiltrate the entire lungs, but they all get swollen up, and also we can't breathe. So, what an inhaler does, or a rescue inhaler, is it basically goes in and immediately reduces that swelling, opens the airway back up. But again, it's a short-term fix. So, this kid comes into me, hey, I've got a flare-up of my asthma. It's jacking everything in my life up, and I'm a elementary school kid, so my life is full of important things that need to be done, like soccer and video games. So, go back to here. We've got our trachea, we've got our bronchioles. They branch and branch and branch and branch and branch and branch. If you guys see the movie Trolls, branch, 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 and branch into the lungs here. So this is going to be the soft tissue aspect of it. What are our lungs surrounded by? They're surrounded by ribs. So behind this, we'll draw our spine like that. And we've got our ribs that come off and they come around in front of the lungs, right? Like this, around here, like that, and like so. Now these ribs are supposed to move up and down like a bucket handle. So if our spine is jacked up, where our ribs connect, those ribs can't float up and down. If they can't float up and down, up and out like so, then these lungs can't expand. So if our spine's jacked up and our ribs aren't moving right, and our bronchioles are all messed up because they're inflamed, and so the amount of air isn't going through there, if we've got a decrease in airflow and a decrease in volume in which our lungs can expand, then it's almost like a double whammy. There's two different ways that the oxygen to our body is being depleted, being taken away. One, through the soft tissue stuff. Two, through the inability of the lungs to actually expand because the ribs are in the way and not moving properly. Now, the third thing, pop quiz. What controls the body? The brain. So if we've got our brain up top here, how does our brain send messages to our body? Through our spinal cord. Correct. You guys are so smart. Now, we've got 7 vertebrae in the spine. We've got in the cervical spine. We've got 12 in the mid-back. And we're going to focus primarily on T1, 2, 3, and 4. So we talked about the association between the ribs that go out and surround the lungs, but also, too, we've got the nervous system that goes and powers the lungs. So, told you, his mid-back was jacked up. His ribs weren't moving right. But if his mid-back is jacked up, then that's also going to affect the nerves that are going into the lungs. Where does the innervation from the lungs come from? T1, 2, 3, and 4. So, bringing this whole thing together, kid walks in, elementary school student, soccer player, asthma attack. What do we find on him? We find that his mid-back isn't moving right. We find that his ribs aren't moving right. We find that this is exacerbated by his asthma attack, or his asthma attack is being exacerbated by this. So what do? We adjust T1, 2, 3, and 4. We adjust T10, because that's right where the diaphragm connects. The diaphragm is very important in breathing. And we adjust C1. He comes back in the next day. Symptoms are gone. He'd already been to the ER. They gave him steroids. After that, and that didn't work, he came into here. We adjusted him one time. He comes in, 24 hours later, totally different kid. Now, he still stayed home from school because he told mom, I just want to make sure I'm feeling good. But we move a couple of bones in his spine. We affect his nervous system. We affect the way his body biomechanically works. And we get more in a 2-minute adjustment than they did in a 2-hour waiting area in an ER, than they did in a 15-minute consultation with the ER doc, than they did in however many times he took the puffer just by moving some bones in his back. Everything's connected to the spine. And it's a lot more than neck pain, back pain, and headaches. Chiropractic is how the body works, or at least how it works optimally, at least if you come in here. So if you've got any of this stuff going on, neck pain, back pain, and headaches for sure, if you got uncontrolled asthma or anything like that, give us a call, walk right through that door. We'll help whenever you come in, right here at Aspire Chiropractic, when you're ready to be your best, naturally.